why are these hair and skin treatments so expensive? In your take,
To make you feel bad.
It has to be expensive. Nice. कितनी देर लगेगी यार? So ये मोबाइल बंद करना. Hi, I am Dr. Vishal Chugh. I am consultant dermatologist and cosmetologist at Radient Skin Clinic, Civil Lines, Jaipur.
What should be an ideal skin routine?
आइडल स्किन केयर रूटीन में आपको बहुत सिंपल रखना है. सी योर स्किन केयर शुड नॉट बी वेरी कॉस्टली बट इट शुड बी इफेक्टिव. सो क्लिनजिंग योर फेस, दिन में 2 बार चेहरा धोना, अप्लाइंग अ मॉइस्चराइजर इन द मॉर्निंग, ओवर दैट पुटिंग एन SPF, एंड एट नाइट वॉशिंग योर फेस अगेन and putting a moisturizer. That should be an ideal skincare routine.
Okay. Is there any particular or the right way to wash a face?
Yes, it depends whether you have an oily face or dry face. If you have oily face, use a good face wash which contains, say, tea tree oil or salicylic acid. And if you have dry face, use gentle cleansers which are non-alcoholic. So washing it twice a day, morning and evening, that should be enough. And it depends on the age as well. Suppose you are less than 30 and between 25 to 30, probably you can keep a vitamin C serum at night. If you are greater than 30, you should use something called as retinols, which are anti-aging creams. Keep your skin soft, healthy and supple. See, I always not promote ki your skin should be a light, your color should be fair or something, but your skin should be always healthy. So keeping a retinols at night will prevent the formation of fine lines and wrinkles to a great extent. That too if started in early age group. So many people do ask for anti-aging creams after 15. So that is a bad idea. Till that time, more of the wrinkles have already started developing it. So around 28 to 30, it is the ideal time to start with the retinol serums at night.
What kind of product should be used and should not be used on a face or skin?
Okay. So you need to traditionally know your skin type first of all. Generally, it is divided into oily and dry. So oily skin is generally shiny and greasy, and dry skin is skin which is flaky, itchy, and it is rough. And there is a third skin type called as combination skin, in which some areas are oily and some are dry. So your skin products should always depend on the type of the skin you have. So oily skin people should use something which is less creamy, which is non-oily, and it should be written on the product doesn't clogs the pore.
Can you suggest some products?
So Cetaphil products, if you have ever heard, so they are non-comedogenic. So they are generally non-greasy. Sebamed products.
Like dry skin or oil skin?
No, generally the whichever the good brand is, they have complete different set of products for oily skin and dry skin.
Okay.
So Cetaphil has a good range, which dry skin and oily skin.
Have different products for dry skin and
Absolutely,
for like
absolutely.
oily skin.
Any good brand, they generally have different products for different skin types.
What other than Cetaphil?
There are products of a company called as Bioderma. There are products of something called as CeraVe. There are products of Sebamed. They generally are categorized as over the counter. I'm not talking about medicated products. We have a lot of different products which are very good for the skin. But I'm just for the general public, I'm telling you about the products which are available over the counter.
There are many brands who they're out in the market. They do big advertisement, and in the last पता चलता है कि they are not actually good for our skin. They are just fancy products. Are they good products? I mean, whatever.
See. As far as the skin goes, if your skin is normal, no harms in using these products. But if you have a sensitive skin, by sensitive skin I mean if you use any product and it gives you an itchy sensation, that means you need to consult a dermatologist to get the right products for you. Not all over-the-counter products may be suitable for your skin type. Say I have a acne prone skin, so sometimes when you get a product like over the counter, like a Pond's cream laga rahe ho, say you are using a Vaseline, that is a bad idea. So your skin may break more after that. People who have oily skin, who have acne prone skin, something like Vaseline is a thick and a greasy product. So it will clog the pores and can lead to more acne. So if your skin is greasy and oily, Vaseline should be a strict no-no. So again, many people use coconut oil on the face. Again, people who have oily and acne prone skin, it should be a strict no-no. Oils will clog your pore and lead to more acne.
Okay.
So
as in, it is good for people who have dry skin.
Absolutely.
It's not a good idea for people with an oily or greasy skin.
Absolutely.
How to get rid of blackheads and whiteheads? अब लोगों को आइडिया नहीं होता कि blackheads क्या होते हैं, whiteheads क्या होते हैं, तो एक बार आप explain करते हैं.
So Blackheads and whiteheads are generally seen in oily skin. When your sebum is over secreted, तो आपके जो pores हैं वो clog हो जाते हैं. That leads to accumulation of sebum material in your pores, and that gives you a tiny bump on your face, typically around the nose area. Nose के आसपास आपको T zone के आसपास दो bumps हो जाते हैं, which can be a white bump, so it is called as whiteheads. If it is black, that is blackheads. But they are more or less scientifically the same. So this is just a grease or sebum material. So we need to exfoliate it regularly to remove it.
Okay, and what is the right way to exfoliate these blackheads? बहुत सारे लोग क्या करते हैं, they pinch these blackheads जिसको निकल जाए easily और
So that is a wrong idea. You shouldn't press your skin. They may leave back marks.
even there is one instrument, I mean,
Comedone extractor. So there is an extractor which is generally available at cosmetic stores, or most of the saloon peoples do use that. But the pressure should be very gentle. You can't rub it into the skin. It may leave back mark. A mild, gentle pressure to open your pores can be done. But it should be under the experienced hand. Like a novice just can't pull on the blackhead or whitehead with that. And you may exfoliate it, say, once in 10 to 15 days. By that, you can use any scrubs available in the market. General scrubs. But excess use of scrubs can lead to sensitive and dry skin. So once in 10 to 15 days, that should be enough.
What if उसको अपन गलत तरीके से exfoliate करें? What could be the consequences?
So the consequences of that, it can leave a bad scar or a mark. Now, if it is a scar, it will not go.
Okay.
If it is a mark, you will have to use a demelanizing creams to get rid of that pigmentation which you created due to extra pressure on that particular thing.
Right. And that is
So many people, many youngsters pick their acne. वो acne को तोड़ देते हैं कि जल्दी ठीक है. Suppose you have a party to attend and suddenly you popped out a acne. So आपको उसको खत्म करने के लिए आप you use a gentle pressure to remove that acne.
Okay.
So that is a bad idea, because that will lead to inflammation, and for sure it will lead to a mark which will take weeks to get rid of that.
Okay, so basically you're saying ki even if there's a party or anything, and if you have acne on your face, nose,
Never pop your acne. Never pop your acne. That is an absolutely bad idea, because for sure it will leave back mark which may take weeks to get rid of this.
Why is there a breakout in teenage and how to control it? ये मेरे से किसी ने पूछा था कि she is around like 16 or 17 and she said कि I'm having breakout. अभी तक मेरे कुछ नहीं था, I don't know why, and मेरे बहुत सारे pimples start हो गए, acne होने लगे. And usually होता भी I have faced in my teenage कि जब I was in like मैं 15 and 16 उस टाइम बहुत अचानक से मेरे बहुत सारे pimples, acne ये सब होने लगे. This is the most common question जो लोग पूछते हैं. So why it happens and what could be a solution, better way to solve this issue?
Okay. So I'll phrase it in words. Almost 70% of teenagers have acne at one point of their time. So that acne is due to hormonal influence. As you hit puberty, your body starts secreting hormones that are called as sex hormones. In male, the testosterone is secreted more. In females, estrogen is secreted more. So due to the influence of these hormones, your skin glands get activated. So more sebum is secreted. You start getting oiliness on your face. And if that oil not wiped out properly, will lead to acne. So it is common for teenage group to have acne. Some may have. That's absolutely normal. So if it is one or two near your chums or due to your eating habits, that is okay. You can just use any homemade things which I'll tell you enumerate. But if there are way too much and they are leaving back marks, so better to visit a dermatologist. Fine. So now what you can do at home, again, as we were talking about, washing your face twice daily is very, very important. If you have oily, acne-prone skin, tea tree oil-based face washes and salicylic acid-based face washes, twice a day washing your face is important.
Okay, so what is this acid? What does it do?
Salicylic acid is basically an exfoliant. It exfoliates your skin. By that I mean
In a natural way.
in a natural way.
And by exfoliating means, removing the dead skin.
Absolutely. It removes your grease on your skin.
Okay.
So when the excess oil is removed and grease from your skin, so you tend to break out less.
Okay. And कौन सी चीजें जो अपन adapt करनी चाहिए for a better skin routine?
Okay.
क्योंकि it's not just the ऊपर वाला कि we can just solve this issue with just cleansing our skin. There are many aspects कि क्या खाते हो that reflects on your face.
Absolutely, diet has a role to play in acne. So when you talk about diet, you should avoid something which is called as high glycemic index. By that I mean excess of sugars, excess of cheese, excess of junk should be avoided. That leads to more generation of something called as IGF, which leads to more acne. So eating clean in teenagers is important. You should not overdo something. See, once in a while fast food is okay, but if you're eating it every day, that's a bad idea. Especially when you have oily skin, acne prone skin, you tend to break out more.
Okay, so let's say junk food, sugar, and
Cheese products,
and
smoking.
let's
These
do one thing. अपन आठ चीज़ ऐसी बता जो नहीं करनी चाहिए for even the teenagers and for the people of my age. Everything need to be included.
So excess of oily food. If I talk about Rajasthan culture, we eat lot of samosas, kachoris. That should be avoided. Excess. I never meant कि नहीं खाओ कभी भी, but don't overdo it. Junk food, especially pastas, pizzas, burgers, should be avoided on a long-term basis. Excess of sugars. है ना? There are lot of baked products like pastries, cakes. Excess of that should be avoided. Smoking for sure should be avoided. Excess of caffeines should be avoided. Alcohol.
Why caffeine? Why caffeine?
I'm talking about excess of caffeine because caffeines have a habit of dehydrating your skin. So sugars leads to excess generation of wrinkles as well. If you consumed in a long-term basis excess of sugars, people tend to get more wrinkles on their skin. Found? So this is sugars are basically they generate oxidative stress in the body. Fine. That leads to breakage of cells and collagens, and you tend to age early. So it is a scientific proof thing. But anything in moderation or limit, I never deny.
Is there any quick way to get rid of acne? Most common question, just some foods there.
Washing your face twice daily. As I always stress, wash. Wash your face twice daily is important.
So मेरे पिंपल हो रहे हैं and मुझे फटाफट से I just want to get rid of this pimple. कि आने वाली कोई coming weeks में कोई party है आपको attend that. And so what could be the best solution? कि फटाफट से इससे
फटाफट में first de-stress yourself, stop seeing your pimple. It doesn't go fataфट. It takes time. So washing your face twice daily is important, and you can use something called as adapalene and benzoyl peroxides. So they are easily available over the counter products, or your dermatologist can write down. You can just apply only on the affected area, either adapalene or benzoyl peroxide. That should help you in relieving your acne from fataфट basis.
These are few of the acids that are available.
Absolutely, it is commonly available in the medical stores. You can just ask them. Better to get it prescribed by a dermatologist, but yes, in a while, suppose you are not in the town, you are not able to meet it, but it has to be applied sparingly only on the affected area.
Okay.
Fine.
Okay, so ये question एक मेरे friend ने पूछा था कि whenever I apply makeup, I get pimples after 1 or 2 days. What should I do?
So again, that means he has acne prone skin. So one basic concept towards makeup is wash is as early as possible. Sometimes you go to a party, apply a makeup, and you come back home tired and you don't wash your face. That is an absolutely bad idea. So that will clog your pores and lead to the acne. So once your party is done, how much tired you are, the last thing you need to do before going to bed is wash your face.
And what is the best way to wash your face after a makeup?
You can just use micellar waters. They are available over the counters as a makeup remover. Or if you don't have anything, just use any cleansing lotion.
And is there any right way to apply makeup? As in before applying makeup, should we apply anything on it?
So makeup should be the last layer on your face. Okay. Wash your face first, apply the moisturizer. Over that put your SPF and then put your. So makeup should always be the last layer. It should not come on the face directly.
So अब कई बार क्या होता है कि लोगों के पिंपल हो गया, मैंने सही भी हो गया, but then it leaves the mark. It leaves that red mark. जो वो लोग होते हैं मेरे 8 महीने हो गए, 6 महीने हो गए, 7 महीने हो गए, like any number of period कि वो जा नहीं रहा.
So that is the reason I was telling you, never pop your acne. If you pop your acne, the chances of it leaving back mark for a prolonged duration is more. Thankfully, most of the marks go on their own over a period of time. But if you are still getting the marks, you are not getting rid of that, you can meet your dermatologist, or sometimes we give something called as kojic acids. Kojic acids are vitamin C derivatives which are available in the market easily.
So is it like something to consume or to apply?
No, it is to apply. It is an anti-blemish.
Okay.
So you apply on that mark over a period of say 4 to 6 weeks and and generally the mark goes.
So it's like a cream or gel?
It's available in both cream formulation and gel formulation. So that if a doctor has to prescribe, I'll see your skin. If it is an oily skin, I'll prefer giving you a gel.
Okay, so let's say अब मेरे 8 महीने से there is a mark. So will it go now after applying this?
See, if it is पुराना हो जाता है तो मुश्किल हो जाता है, तो probably you will have to meet your dermatologist.
Okay.
If it is a fresh one and you don't have a time to visit a dermatologist or you don't have an access to a dermatologist, so kojic acid creams are easily available in a medical store. You can apply that for a desired period of time only on the affected areas.
Okay, so like say ये short period वाला हो गया, ठीक है, अभी हुआ वो mark रह जाएगा तो उन्होंने पहले ही apply कर दिया. Okay, now say उन्होंने 8 महीना, 8 महीना, 7 महीना जो जा ही नहीं रहा. So what is the solution?
For that stubborn pigmentation, we have things called as chemical peels. We have lasers at a dermatologist clinic. I think getting it done should help you in removing that scar.
So you are saying कि chemical peel करा लो या फिर other laser treatment that are available.
Absolutely.
What would be the best कि उसके हिसाब से?
Depending on the skin type.
Depending upon the skin.
कितने marks हैं, कितना है, तो अगर थोड़ा बहुत है तो probably peels will help. If it is deep enough, probably lasers may help. Depends on person to person.
Okay, अब ये ट्रीटमेंट के नाम से ना लोग डर जाते हैं कि वाह आप ये मुझे केमिकल पील कराना पड़ेगा, मुझे ऐसा ट्रीटमेंट कराना पड़ेगा, क्योंकि लोगों के मन में मिसकंसेप्शन है कि ये अच्छा नहीं है स्किन के लिए, साइड इफेक्ट्स होंगे, इसके बाद भी साइड इफेक्ट्स होंगे, कोई ना कोई लाइक XYZ. सो व्हाट इज योर टेक ऑन दैट?
सो आई एम हैप्पी कि लोगों को डर है थोड़ा बहुत इस चीज के लिए, बट ऑन द कॉन्ट्ररी आई एम हैप्पी टू हैव मेनी ऑफ माई पेशेंट्स वॉकिंग माई क्लिनिक की डॉक्टर आई वांट टू गेट लेजर्स डन. सो पीपल आर गेटिंग एजुकेटेड डे बाय डे कि देयर आर ऑप्शंस व्हिच कैन बी यूटिलाइज्ड विद द हेल्प ऑफ अ डर्मेटोलॉजिस्ट, एंड इफ अ डर्मेटोलॉजिस्ट इज सजेस्टिंग यू समथिंग, बिलीव मी इट हैज टू बी सेफ. सो नो डॉक्टर विल सजेस्ट यू समथिंग व्हिच इज नॉट सेफ फॉर यू. सो यस, एज अ लेमैन हमें डर लगता है कि केमिकल चेहरे पे लगेगा, पता नहीं कोई हार्म तो नहीं हो जाएगा. मुझे बहुत सारे लोग कहते हैं डॉक्टर मेरी स्किन पतली तो नहीं हो जाएगी, बाद में सेंसिटिव तो नहीं हो जाएगी. आई ऑलवेज tell them if a dermatologist is suggesting you something, he can't do harm to your skin. He is there to help you out, and there are options available at clinics which can help you in improving your skin.
Okay. And usually इसमें sessions होते हैं, right?
Absolutely.
कोई treatment आप कराओ, laser कराओ या chemical कराओ, these are session. एक बार में थोड़ा सा ही
वो absolutely. So they are generally 4 to 6 sessions depending on कि हम lasers कर रहे हैं, peels कर रहे हैं, so that a dermatologist will be able to guide you. So it's not a one-time thing. So don't expect. I always tell my patients, skin is a commitment. It's like gym. You hit the gym the very first day, you expect कि बहुत अच्छी body बन जाए. It's not going to come down. We see all these film stars, all these actors, they slog for so long hours. The same goes with your skin. Your skin may require a time. Be with your dermatologist. He or she may be able to guide you properly, and it takes a good patience and commitment towards your skin. So good skin is nothing a miracle. You can't get an overnight good skin.
Right.
Until and unless you are blessed with a good gene, like you are. So not everyone get that.
Okay, can you suggest some good hydrochloric acid serum?
I think you are talking about hyaluronic acid
Yeah,
serums.
sorry,
Hyaluronic acid.
hyaluronic acid.
Yes. So this is in so much of demand these days. Sometimes patient comes to me, doctor, I want you to write down an hyaluronic acid serum. First of all, for general public, I'll try to clear it what it is. So it is basically a moisturizer. It is a high molecular weight moisturizer which absorbs lot of water. So it hydrates your skin. So people who have dry skin, using an hyaluronic acid based serums should be a good idea.
Okay, but that is just good for the people with dry skin, not with oil.
So anybody can use it. It is something to give you hydration in your skin.
Okay.
But simultaneously, I'll add, let's say it is not an 100% necessity thing.
It's just an add-on.
It's an add-on. So using it should be beneficial for your skin. But it is not like that. You can't do without that.
Okay, so आजकल मार्केट में बहुत सारे फेस मास्क आ रहे हैं. So what is your take on that? I mean, are they really good? Are they really worth our time and money? Or like, what do you think?
See, if anybody has sensitive skin, they should avoid using all these things. By sensitive skin, आपको खुद को आइडिया होता है कि डॉक्टर मैं कुछ भी लगाता हूँ तो मेरे चेहरे पे जलन हो जाती है. So people who have sensitive skin, they should not use anything without a doctor's recommendation. But if it is a normal skin and you are used to using since long, no harms. So I have seen girls before their marriage, before their D-Day, somebody asked them to apply, डॉक्टर एलोवेरा लगा के आई हूँ, मेरी दादी ने बोला घर पे एलोवेरा पड़ा है वो लगा. So I have seen reactions to even that. So you should be very careful, especially before your D-Day or especially before your important event. Please don't try anything new which you haven't tried ever. And even if you use something, try using as a test patch behind your ears. Keep it for 10 to 15 minutes. If it doesn't irritates you, probably you may try on your face. I'm using a word may.
Okay.
Still, there is no 100% surety कि everyone will suit everything fine. So this is just to cleanse your face. जैसे if I talk about age-old tradition of लोग मुल्तानी मिट्टी चेहरे पे लगाते. So these packs are modified form of something to cleanse your skin. So if you have a sensitive skin, please don't do it. If you do have a normal skin, you can use it once in a while. I don't mind.
So अभी market में there are some new products जैसे there are pimple patches. I mean if you have heard about this, उसके अंदर salicylic patches ये भी उसका term है. So would you suggest लोगों को जिनके थोड़े pimples हो गए acne हो गए उस पे?
Yes, this is a quick fix solution. It helps, but apply it only on the affected area. Fine. Suppose you have a party event coming up in a day or two and you don't have time to visit your dermatologist, you can use the salicylic acid pads. Patches जो बहुत commonly available है. No harms in doing that.
So on an average like कितने दिनों में ये लगाते हैं जिससे effect पड़ता है?
See, it shows improvement within 3 to 6 days. Fine. So no harms in doing that, but excess of anything should be avoided. So once in a while if you are getting acne और एक दो बार patch लगाया, it's okay. But आपको बहुत recurrently pimples हो रहे हैं and you are just applying the patch, you may have internal reason to get the acne. Okay. So getting it sorted out by a dermatologist should be a good idea.
Okay, so एक और मेरे से question किसी ने पूछा था कि fillers for under eyes dark circles and how safe are they and the cost?
Okay, so under eyes dark circles can be treated to a good extent with the fillers, but only with people who have fat loss beneath the eye. So कई लोगों को हम हिंदी भाषा में बोलते हैं काले घेरे हो गए, dark circles हो गए, but that exactly is not a dark circles. You start with age, you start losing fat beneath your eyes, and sometimes your cheekbone is heavy, तो ये बाहर की तरफ है, eyes अंदर की तरफ. So filling that gap with something called as fillers, which are basically hyaluronic acid, can be done, and it gives you significant improvement, say supposedly 70% improvement, but they last for certain duration of time. The effect of fillers lasts for around 1 to 2 years depending on the age.
And are they safe?
Absolutely safe. If it is done by a trained.
Like a fill, I mean, put my arm or like कुछ भी हाथ से लगाया कुछ भी. So are there any chances कि उसका कोई
No, they are generally done by a trained dermatologist. If a trained dermatologist has done it and placed it at the right area, so you need not worry about side effects.
Okay. So there are no side effects as.
So absolutely nothing if done by a trained hand.
Okay. What do you suggest? I mean, इसके कोई sessions होते हैं इस चीज़ के या it's
No,
just
as I told you, it's a one-time solution, but the effect lasts for 1 to 2 years depending on the age and the skin. So you need to get a refill.
You say what is the right age to get this thing?
So there is no right age. It depends कि आपकी skin बहुत ज़्यादा fat loose हो चुका है, तो probably we can do it 24-25 as well. On an average, Indian skin में it starts around 38 to 40 years of age. So उसके बाद ही लोग इसके लिए आते हैं. But yes, we can do it 24-25 as well, depending on कि कितनी severity है.
And इसमें like क्या cost होगा?
See, it is difficult to say without seeing the patient. If I have to do 1 ml of fillers, the cost is approximately around 25,000. If I have to use 2 ml, it may double the cost.
And this treatment will only last for like 1 or 2 years.
Absolutely.
And then we can
Redone.
redone that treatment.
Absolutely.
Alright, so we are done with the skin part.